everyone. I am Surarna Sawant, Chief Dietitian, HCG Cancer Center, Mumbai, Borivali unit. Today we are going to talk about nutrition in the journey of cancer. Now, why nutrition is so important when we are dealing with a disease like cancer? We all know for the smallest of things, even if we go to a general physician, what is the last thing you ask the doctor when you get out of the cabin is, "Doctor, can I eat everything?" So, we know how important food is for us in our day-to-day life. So, all the more important when we have been diagnosed as we are having cancer, we need to have nutritious food. There are certain things we need to follow. First is we have to follow a healthy lifestyle. As far as possible, eat all kinds of foods and have a healthy lifestyle in the meaning keep doing things on your own till you can. Maintain your weight because it has been seen that a gain of weight or a loss of too much weight is going to increase the number of infections during your treatment. It is going to increase the number of side effects during your treatment. Also, if you have proper food, it is going to prevent a lot of deficiencies that come in due to your treatment, and also it will help in your fast recovery. How do you ensure that you are having a proper diet? See to it that your plate itself is appealing to you. It is a colorful plate wherein you can feel that yes, you need to eat. It has to be a protein-rich diet because your cells need to be replenished. Because whatever therapy you're going through, the chemotherapy or radiation, your normal cells are also going to get affected. And to get them going, we need to have a protein-rich diet. Now, what are protein foods that you can take? If you are a vegetarian, you need to take milk and milk products. You need to take sprouts. You can have paneer. You can have soya. And yes, of course, you always be in touch with your dietitian to understand what more and how much can you do for yourself. If you are a non-vegetarian, you can safely have eggs, seafood and fish. You can try and avoid chicken or red meat if you do not digest it properly because of your treatment, or else you can always go ahead with chicken. The second most important thing the patients face during cancer is your hemoglobin levels, for which it is not a one-night thing that you eat something and your hemoglobin comes up. You might require certain blood transfusions, but to keep up with your hemoglobin, see that again you have a protein-rich diet, plus you have to have an iron-rich diet. Now, iron is available in all possible things, but the problem is the absorption of iron in your body. So, it is a myth when people say that you have a carrot beetroot juice, you can have your hemoglobins coming up, but that's not true. Beet and carrot, yes, they might be rich in protein, but the iron is not readily absorbable in your body. So what are the iron-rich foods? They are green leafy vegetables like spinach, methi, amaranth leaves. These you can have. There are drumstick leaves which you can have. Also, there are seeds known as garden cress seeds, also commonly known as halim, which can be taken up as an empty stomach soaked overnight, which will increase your hemoglobin levels. Always remember, never take milk with your iron-rich foods. Also, there are certain side effects which you might face. It's not that you will, but you might face during chemotherapy and radiation. These common side effects are nausea, wherein you will all the time feel like vomiting. Might be you won't, but that feeling is always there. So try and see that you, if possible, do not cook for yourself if you are having nausea, because those strong smells during cooking can increase the nausea. Also, do not have things like lobins or agarbattis going on, or very strong perfumes that you are using. That can also increase the nausea. What can decrease the nausea is things like lemon, mint. If you use in your regular food, that will decrease your nausea. Always sit upright when you are eating and do not lie down for the next 15 to 20 minutes immediately after eating. These are little tips which will help you to prevent your nausea or at least decrease it to some extent. Then there are taste alterations because of the therapies, specifically radiation and chemotherapy. for which the doctors always ask you to keep oral hygiene. Usually patients, are lazy enough to follow it, and then they have taste alterations, and then their food intake goes down. So avoid all these things. Cleanse your mouth, have more of water or liquids. This also helps in, keeping up with your taste buds. Do not have very hot or very cold foods. These also might, have a lot of taste alterations. Always have small frequent feeds. Like you cannot sit and have a plate full of things like you usually used to have. During chemotherapy and radiation, it is essential that you have something every 2 hourly. Might be a fruit, just might be a protein shake, or it just might be some sprouts. Or whatever meal you're taking, your breakfast, lunch or dinner, try to divide it into 2 portions and have it slowly. Do not take a lot of fluid while you're eating your food, because then fluid is going to fill you up and you're going to go down on your food. Again, you will be deficient in certain things. Eat the best of the food in terms of calories and proteins when you are the hungriest, and that usually is during the morning times. People feel hungry, so eat your best food at that time. Try and keep small foods by very like where you can get them easily, like your nuts or something like that, which are rich in protein, so that just while you are roaming in your house, just going from one room to another, just put in a piece. Sip in between meals. Like it is best to have some protein shake or something which your doctor or dietitian will recommend to you. So don't try and have that protein shake at one go, just don't gulp it down. Try to sip in between meals, like how you would sip a cold drink while you're watching a movie in a theater. There are other complications like diarrhea, etc., wherein we know that during diarrhea we need to stop the milk and milk products, have more of buttermilk you can have more of soups. Try to avoid outside food as far as possible. There are certain patients who will be facing things like mucositis or ulcers, during which they cannot tolerate any type of hot food, no type of spicy food. In fact, there might be a time when even salt is not tolerated. So you have to see what is your tolerance level and eat accordingly, some semi-solid food or liquid food, but from time to time, so that your body is not deprived. Constipation is another thing which can be relieved by certain medications, and of course by a high fiber diet, by having normal green leafy vegetables. You can have boiled salads in your food, you can have chapati, etc., wherein the flour is not sieved, so you will get fiber from these foods.